Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Dr. Harrison is an emergency physician and lifestyle medicine physician based out of Fairfield County, Connecticut. She grew up in Southern California, born to parents who are Cuban refugees. After completing her undergraduate degree at the University of Notre Dame, she attended Weill Cornell Medical College in New York City, graduating with honors in service. She completed her residency training in emergency medicine at New York Presbyterian Hospital and served as chief resident in her final year. She married her husband during residency, and after having her first child in her final year, they moved to Connecticut, where she took a position in the emergency department at the Yale School of Medicine. During her time at Yale, Dr. Harrison served as an assistant program director for the Emergency Medicine Residency and was an assistant professor with a particular focus on improving learner feedback and in educating new first-year residents on the principles of adult learning and basics in emergency medicine. Upon leaving Yale, she sought to understand her own health with a new lens and is now also board certified in lifestyle medicine. She worked as a part-time emergency medicine physician at Bridgeport Hospital, Yale New Haven Health, for over 5 years. She's also active in her community, taking on an increasing number of public health roles, including serving on the local Health and Human Services Commission, speaking at local libraries on various lifestyle medicine topics, and leading and co-founding a parent group in support of healthier technology for kids. She is involved in the American College of Lifestyle Medicine and practices lifestyle medicine with a telehealth company, Summit, providing client consultations and webinars. She is active in her faith community and has recently joined the board of Young Life. Although she has a great passion for medicine, her faith, husband, and 3 daughters will always take priority. Welcome, Raquel. It's so wonderful to have you here.
Thank you so much for having me. It's a pleasure to be here.
And this talk is especially special because after all these years, so for listeners, I had the pleasure of training under Dr. Harrison. She saw me from my first day in internship all through the 4 years at Yale.
And kind of unbelievable.
Yeah, this is such a special treat to be here like this. It's amazing how life takes us on journeys and we end up in parallel.
Extremely grateful. Thank you for having me.
Thank you. I'd love to know from your background how you end up finding lifestyle medicine.
So it's kind of a little bit of an interesting story, as I think all journeys are, right? Especially when they seem so opposite in nature. I mean, you go from the emergency department where everything's driven by acute illness to really switching gears and leaning into a more preventative health perspective, right? And so during my time at Yale, I unfortunately ended up finding what gratefully ended up being benign, but a mass in my breast, and ended up on this journey of trying to understand how I was taking care of myself amidst trying to build a career. And it really just took me back and made me actually think about my family more. And this idea that my career has been something wonderful that's given me purpose and meaning, but ultimately my family was what was anchoring me and my faith. And so I decided to take a step back from Yale. And during that time of finishing up there and starting the part-time position at Bridgeport Hospital, I came across a magazine in a smoothie shop that had an advertisement for lifestyle medicine. And I ended up in a rabbit hole Google search of what could this possibly be, and found out that there was not only an American College of Lifestyle Medicine, but also a pathway to board certification for physicians. And part of that pathway included getting a certificate in plant-based nutrition. And ultimately, when I took the moment to reflect, I realized I knew nothing about actual nutrition and what the practical, sustainable piece of that meant for my own life, my family's life, and my loved ones, and then obviously by extension, my patients. And so I ended up saying, well, why don't I get this certificate in plant-based nutrition and see where it takes me? And I loved it. And so I dove in there and ultimately ended up continuing to pursue the certification in lifestyle medicine. And what was fascinating is this was all actually as COVID was starting to hit. So I ended up being a little bit less traditional in kind of how I actually went through the process of getting certified because of COVID. But all of this kind of started as our world was being confronted with effectively, how do we take care of ourselves and what really puts us at risk for disease? And it was an interesting time, but really obviously formative, and has kind of given me a lot of energy as I've pursued learning more and kind of navigating that space more in my career.
Thank you so much for so candidly sharing your journey. And it's amazing. In emergency medicine, you see everything, right? Life and death.
Right.
And as reactive as our healthcare system is, as much as it emphasizes symptomatic care, the one thing I am always eternally grateful for emergency medicine is that privilege of seeing death so frequently, because like you mentioned, or when something happens, it just makes you question, what am I doing? Where is my life? And where are my values? And what's most important to me? And, starting with nutrition, the most basic thing, right? The most basic things in terms of what do we eat. But unfortunately, we don't get that much education for that.
We really don't. And hopefully there's a changing tide in the medical education system on this. And the idea of food being medicine is really gaining some credibility and power. And I actually think the College of Lifestyle Medicine is doing a lot to promote that. But it really is fascinating. I mean, if I got 1 or 2 lectures in medical school on actual, like, what we should be intaking on a regular basis, that may be being generous. I don't know.
Intaking, and then unfortunately, when I know some hospitals have healthier options, but most in the middle of the night, it was, I think, macaroni and cheese and fried chicken.
Yes. No, absolutely. And just as we care for ourselves while we're working, right? And what we're handing our patients and everything that kind of goes in between. But, it's interesting because even in that journey of, well, how do you go from emergency medicine to kind of seeing the other side? What's fascinating about the lens that I think both of us have is you see what happens when you don't take care of yourself. You see what the end game is, to your point of being confronted with death, but it's not even just that. It's the debilitation that happens prior to death, right? I think so much of our medical system has been focused on longevity as a number, and thinking about longevity as simply, can you live to being 105 or whatever the goal people have is. But if you take a step back and say, well, living till 105, but if you have no quality of life, like what does that actually offer? And what does your health span actually look like? That number of how many healthy years you have. And I think that's really where that emergency perspective weighs in a lot, because unfortunately we are often confronted with that debilitation. And I think it's something like 50% of US healthcare dollars are spent in someone's like last year of life. It's a really high number, and it might even be greater than that. But that idea of what we see in the hospital is really kind of that end piece, and what lack of quality oftentimes comes with it. And that's really challenging.
Extremely challenging, and also really difficult once you understand the medicine. Like you had mentioned, the American College of Lifestyle Medicine, there have been many more strides to move the needle, and obviously more needs to come, because as you had mentioned, the cost of dollars, the amount of time people spend the last year of life. And most of these diseases that cause morbidity and mortality can be preventable, which is what lifestyle medicine teaches us. And yet that's not the emphasis, unfortunately.
Right. Yeah. You think about, it's something like 95% of what shows up in the emergency department is all related to preventable disease. It's big.
Yeah. Huge.
It's really big. Yeah.
So this reframing, this looking at the more quality, you had mentioned health span and nutrition as well. What other things did you find that lifestyle medicine, learning this curriculum and going this path, brought you that might not have been there in either conventional medical education or even just regular, if you think about all of our education, this should be in high school.
Yeah, no, absolutely. So particularly for some people who may be listening who aren't necessarily as familiar with lifestyle medicine, and I know you're planning on including some resources, but lifestyle medicine is really looking at the evidence of how lifestyle can prevent and reverse disease, right? And there's 6 pillars, and and it's fascinating because these 6 pillars, so nutrition is one, and it's really whole food, plant-based nutrition, exercise, sleep, avoiding risky behaviors, social connection, and stress reduction. And of those 6, nutrition obviously was somewhere where I felt like I had the most to gain from a just pure facts perspective. That being said, diving into the evidence behind the impact on our physiology, on both sleep and social connection in particular, resonated so much. I think in having gone through our training, asking residents to go through the training on a regular basis when I was in that role, and how unaligned the ability to care for yourself when you are a provider, as you start looking at all of this evidence, is really fascinating. And it's unfortunately a bigger systemic issue in terms of why, as physicians, we need to work through the night and completely disrupt our circadian rhythms, right? That's a bigger that's a much bigger question. But learning about sleep, our rhythms, how important it is to maintain those rhythms, what impact our nutrition, our exercise has on those rhythms, and how interrelated and complex it is fascinating. I also have a particular interest in social connection and the evidence behind that. I just think it's so neat to think about how interrelated we are as humans and how we absolutely just need each other. I love it. And so that diving into that evidence has been really fun to be able to exercise that muscle, that scientific muscle, but in a way that hasn't traditionally been part of our medical conversation.
Can you tell me more about what you mean about how it's different than traditional medical conversation?
Yeah, I think what's nice about lifestyle medicine is our goal really is to think about how habits and lifestyle can in some ways impact our health in a way that almost can compare to pharmaceuticals. I think some of our most tangible data-driven studies are ones that say, for example, 20 minutes of walking is just as good as 10 milligrams of lisinopril, right? Like that's really powerful. Someone can relate to that. Oh, you mean I might actually get off of my medications if I exercise on a regular basis. And there's real teeth to that. And so to be able to say, hey, I can actually prescribe a lifestyle intervention is huge. That being said, the other piece of this social connection is we have increasing data that loneliness contributes to dementia, Alzheimer's, and the perpetuation of a lot of these chronic inflammatory diseases, including diabetes, right? And so if you can help people reframe things and look at it in a different lens that says, no, actually, reaching out to that person you love or want to spend time with has real implications on your health, or maybe even trying to combine a walk with social connection and asking someone to come along with you, that has additive synergistic impact. And so I love being able to point to studies and actually have that conversation that I used to have about metformin or insulin or lisinopril for that matter, right? Whatever the medication may be, and not trying to pick on one, but that idea of there's real power in our regular habits.
So it's the positive social connection, really, and just having that it show up in all ends from people we interact with, from our healthcare providers, and
Yes.
that usually is not the conversation, like you mentioned, we have in traditional medicine.
Right. And it's important. And I think a lot of us in medicine went into it because of that ability to interact with people on a regular basis. And that's been significantly reduced and changed and doesn't look the way most of us thought it was going to look. It's tough.
Yeah, the time constraints, and then all the EMR and admin and technology now, the amount of FaceTime, I know, like even just one generation of physicians before us had, is quite different than what we're used to now.
That's right. That's right. And our patients need that to heal. Right? So, as much as it gives us fulfillment and probably protects us from burnout, being able to have more of that face time, our patients also need to feel like they've been heard and have had that time with us. And so it's become a very challenging environment for so many different reasons.
Agreed. And it's interesting, I feel like as medicine has become more and more compartmentalized and fragmented, I feel like there's this natural evolution, obviously, of physicians towards more coaching and more holistic means of communication, because I feel maybe once upon a time, rewind before managed care, or when you didn't have like 7 minutes per patient with the attending in the emergency department, a physician, we used to be able to do all of that, to honor that communication, to prescribe these things. And now, because of the way the system has evolved, obviously coaching, health and wellness coaching, this field especially, is becoming more and more integrated into the healthcare system. And why? Coaches don't provide medical advice. They don't diagnose, they don't treat. They literally help bridge in gaps of applying the physician's advice to the patient's life and giving that face time, that one-on-one attention that doctors are no longer able to provide anymore. And so that's been one of the very interesting things watching the field of coaching evolve. I feel like this all used to be part, it is all medicine, and it all used to be part of a physician's toolkit that now is changed.
Yeah, no, absolutely. And that ability to spend time with patients and understand what resonates, right? As a lifestyle physician, I've got this whole toolkit of interventions, but if that intervention isn't going to work for that specific person, I get nowhere. I get no results, right? And so that's what makes pill prescribing easy, because you have a smaller toolkit and you can try one thing, and if it doesn't work, you can try a different one, and it's the same habit that the patient needs to respond to, right? They have to take a pill every day. But then you deal with compliance, and so there's still kind of lifestyle piece to that, I suppose. But without being able to approach and using more of a coach-like approach, you can't get to the underlying piece of what actually is going to resonate for this specific person to actually make the change. Because once you do find that piece that resonates, it's like night and day for people. It's amazing to me how many stories I have of this point of one conversation and it just happened to land right. And all of a sudden the person's dropped their cholesterol 50%, or whatever it might be. But that requires time to navigate the conversation in a way that allows the patient to drive it, which is what coaches do. It's imperative for all of this preventative care.
I didn't even know until speaking with you, you had told me that there was a significant portion of the lifestyle medicine curriculum that's focused on coaching, which makes a lot of sense given everything we've talked about.
That's correct. And it was fascinating to learn about, because it's much less about, let me give you my expertise as your physician and all the advice I've learned over the years. It's right. It's, can you drive this conversation so that I can help you in the best way possible?
So it seems like it's wonderful that the American College of Lifestyle Medicine exists, and they have done all this work, because then I guess providers and health and wellness coaches can learn about this and be able to support doctors more, and therefore be able to help more patients help themselves get better.
Yeah, absolutely. And I mean, if I were a primary care physician and working alongside a coach, and the coach came back and told me, hey, these 3 bullet points are what resonated the most, and these are the goals we created. This is what, based on the things you were most concerned about regarding their health, that ability to create a plan that's consistent, and then potentially having the coach follow up so that you can see them again in 6 months and check in, it's super empowering, I think, to a primary care physician.
Yeah, it's team-based care right there.
Mm-hmm.
Yeah.
And value-based care, right? Which is hopefully where we're shifting to. Unfortunately, I think we're still far from, but it really is creating a healthier, valuable approach to care.
And you had talked about the empowerment aspect of it and really meeting the other person where they're at, like finding that one thing that resonates for that person you're talking to. And that's aligning the values with actions and how you decide you want your care to be is often another critical missing piece of our healthcare conversations these days.
No, that's right. And I think one of the other things that kind of resonates is how do you also make the most of a short amount of time with your patients? And so for physicians that may be listening or other healthcare providers that don't get that full 30 minutes with somebody or even an hour or more, depending on your practice, but it's really how can you start inserting questions that break down barriers that allow you to go deeper, right? So one of the things that we've chatted about before that's fairly taboo in medicine is asking about people's faith or spirituality. If you are able to connect with someone on a level like that, where it's just recognizing that there's something outside of themselves, they potentially open up in a way you never expected and are able to use that to help them live a physically healthier life, right? And so, it could be questions about faith, spirituality. It could be questions around meaning and purpose. It could be questions around social connection. I find that actually leading with those questions can open up a host of different opportunities for how to encourage someone on their health journey. If I am talking with someone, I ask about social connection, and they say something along the lines of, oh, well, I would exercise, but I have to take care of this person or that person. I try to leverage that and say, okay, well, what can you do while you are in that caretaker role that increases your movement and gets you away from that sedentary lifestyle, right? And so unless you ask certain questions, and what often happens is they reveal barriers to their health journey, right? And you can use that to really kind of navigate how do you actually make those changes for them in an impactful way.
And the connection, like you mentioned, how do you transform so quickly and get so deep? Once you connect with that part of someone that they're not often asked about, their intrinsic motivation gets evoked because if people do everything. If there's a will, there's a way. And if someone just lights that fire, plants that seed, it blossoms.
That's right. You just need to plant a seed.
And it's also thinking about the history of medicine, like the last century or two compared to the last thousands of years of which medicine's practiced. You look at the Bible, most scriptures throughout the world, indigenous cultures, Eastern medicine, healing was attributed with the divine. There was always faith associated with it, and there are a lot of prayers with it. And so med schools now, even throughout this country, with their mission statements, still have often their religious statements there too. And that separation of faith and spirituality, or maybe the more of the dissociation, more as we go towards this evidence-informed, very logical space, there's a place for both of them, and it's needed for both of them, because for providers, you have a disconnect with fulfillment and what are they doing in their purpose. And for patients, they also have this disconnect. And so you have both people experiencing frustration from this missing piece of the puzzle.
That's right. And I think what's interesting is there is increasing evidence out there on having a spiritual faith-based mindset to improvement in physical and emotional health. There's someone in particular, Lisa Miller at Columbia. She's doing a lot of research around this and has found that having a spiritual mindset is like 80% protective against depression and substance abuse disorders. It's a very high magnitude. It's a pretty impressive kind of conceptual research, but that's probably something we should be engaging with more in our conversations.
Yeah, it's wonderful to have that gift. I can't even imagine going to a doctor's office and asking them, like, what are my values in life, or how would you want this care to be? I just, that would be amazing.
Right. And it's really important too, from the perspective of even just for ourselves as providers, right? That idea of, okay, when you are confronted with so much disease, right? And you're trying to fight that battle in a lot of ways on a regular basis. When you remove yourself from those environments, how are you caring for yourself? And during that time, are your values aligning with how you're spending your time? And that's really, really important. And I don't think we spend enough time talking about that even for ourselves, and that, especially in that conversation of protecting us from burnout.
That question is so powerful. How do your values align with how you're spending your time? Even just to think about that in a 24-hour day, I always get humbled and have to reframe and reprioritize. And I feel like it's a constant process.
It is. And it's a big challenge. And especially when we think about providing for our loved ones and everything that comes with that, and the responsibilities and the sense of duty and obligation. But finding those moments of how does this actually fit in with what's important to me? And this is actually part of the reason I've dove into technology and the parent group around limiting social media and trying to encourage face-to-face interactions among young people locally, because that idea of to really have that authentic piece to interactions and starting to create your own values and priorities as you're growing up, right? It's important. If we miss that opportunity, we're going to be in a tough spot moving forward.
It's such a gift, and screen time, I feel like, or the impact of devices on social skills, cognitive development, relationships, and all of that health. That's a whole other topic. That yeah,
It
that
is.
is. It's amazing what's even just shown up in the past 10 years.
Yeah, no, and it's fascinating. There's some interesting research on just the destruction of even just micro interactions, the conversation you might have waiting in line at the grocery store, and what kind of impact that has to just boost your energy, even just a little bit, so that as it slowly trickles down during the day, a small interaction will then bring you back up. And so that idea of we need those. We're very social people, social beings. It's interesting, fun evidence and social experiments that have been done.
It's amazing what we take for granted. I think that was one of the biggest lessons, what we take for granted, like even going to school until it's gone.
Yeah, no, that's right.
I guess one of the things I wanted to ask you was, it's so wonderful that you found this path. And obviously, it's very evidence based, it's very human based, very innate wisdom. It all aligns. I think one of the tricky things is what happens when, let's say, a coach or a healthcare provider, someone has this knowledge of lifestyle medicine and all the wonders with it and all the power with it and impact. But since it isn't in traditional medical education, since it's not traditionally in the healthcare conversation, what happens if, for instance, there's a little, I don't want to use the C word like clash, but there's a little bit of a lack of awareness is a better term. And because I know, especially for coaches listening to this, so many are so well informed on lifestyle medicine and different tricks and techniques and it's finding the one that works for the particular person, right? And so, one of the hardest things, especially with, let's say, cancer or any chronic disease like diabetes, heart disease, is on the one hand, you're being told that these diseases are irreversible and there's nothing that can be done. And then on the other hand, there's maybe on a biological level, first of all, Andrew Weil has this whole book on spontaneous healing. And even though that's not the norm, hopefully not yet, maybe one day, there are other stories like that. And it's even just switching the language to realize that even if healing may not be reversible on a physical level completely or curable, there's our emotional, mental, there's so many other domains of health that can be nurtured. And so how have you been navigating that with colleagues? And how do you, I don't know if you have any advice for coaches or anyone supporting the system? I know it's a big question.
Yeah, it is a big question, but I think it's an extremely relevant one, and it's an important one to ask, right? Because ultimately, if we're going to make any kind of shift in medicine, we have to acknowledge, right, that things as they currently stand have not been working, right? And I think that's a little bit of the approach I often take. And I think I said this earlier, but what lifestyle medicine has really done for me is given me the tools to use the same language I've been using for the last 20 years and just apply it in a little bit of a different way. To be able to say there's randomized controlled trials out there that suggest that isometric exercise reduces blood pressure more than simply walking, and just to that varying degree, to be able to sit in conversations and actually be able to spew that evidence just as we would have on rounds in internal medicine about this drug or that drug. That's, I think, really powerful. And lifestyle medicine is still trying to sit in Western medicine, right? And we're trying to change the conversation in Western medicine. And it's, yes, acknowledging that integrative functional Eastern influences and other Ayurvedic approaches can be really helpful and powerful. For goodness sakes, they have thousands of years. They might not have randomized controlled trials, but there's thousands of years of experiential learning there. The piece that is really kind of that sweet spot, like I said, is that ability to say, no, there are studies with the same rigor that are published in the New England Journal of Medicine that offer the critical importance of lifestyle interventions. And that's what I love, and probably that's where my wheelhouse is. Also because you can dive into so many different things and go in so many different directions with this stuff. And so just like I'm selling a consult in the emergency department, I often take the same approach of, no, like we have to do this differently. I understand, hot topic right now, there's potentially really big value in some of these GLP-1 medications. But without lifestyle intervention, you're going to get nowhere, and this person's going to be stuck on a GLP-1 for years, if not for the rest of their life. And from a nutritional absorption perspective, that's probably less than ideal. And so to be able to come alongside and say, hey, there is real value in some of these pharmaceutical interventions, but without getting to the root cause, in 5 years, we're just going to have to treat the side effect of that pharmaceutical intervention. And I think that's where the real value comes in this team approach, because there's just too many people that for too many years haven't treated their body well, and there needs to be more of us. That's the bottom line. We can't do it alone.
It's beautiful hearing the joy in your voice, the passion.
I get all revved up.
It's inspiring, to feel a way about medicine, using all the knowledge you've had, and paths unfold differently than what we planned, but you built on it and in a way that's so constructive. And this is how medicine changes, because of people who have the strength to pivot and learn what aligns with them and find that joy. Yeah. Such a gift. So just to close this interview then, for our takeaway, do you have any takeaway messages for our listeners? Any coaches, healthcare providers listening to this?
Absolutely. I couldn't be more energized by the idea of creating a team approach. Most of what I do in terms of individual consultations is with a telehealth company, but what I do most is conversations, workshops, lectures in the community, and encourage people to find health coaches, nutritionists, physicians who are of the same mindset. And so I think there are an increasing number of physicians who would love to dive into this stuff. And all they need is someone to come alongside them and say they're willing to support them in the sense of being a team. And so I just would encourage people not to hesitate. If there's someone who you've come across that you're like, oh, I would love working with them, reach out, because you just never know where things are going to land. And if I've learned anything on this journey, that social connection piece just is so important, that will really resonate too in that kind of team approach. And it brings a different feel for patients too. There's a lot more joy when they feel like they have a team of providers coming around them. So I think just encouragement would be my takeaway, to kind of keep going in whatever way that motivates you the most, because that's where you'll be the most successful and make the most change.
Thank you. Yeah, I'm still sitting here how you had mentioned with the social connection, that tiny little, these micro interactions that boost your day. Mm-hmm. In terms of this interaction, I never would have imagined after graduating residency all these years ago, I'd ever have the opportunity to do this with you. And so that boost, that's something that will last a really long time and created such a beautiful memory. So thank you so much for your time. And the other part that really resonated me from this was another thing about what you said, which is how one of the things about lifestyle medicine, it kind of just allowed you to harness what you know, shift the conversation to have those evidence-based talks about lifestyle medicine and the way you would with grand rounds. And that's, I think, what drew me to coaching too, because it took everything that I love about social communications, everything, to empowerment. And it's just nurturing, like growing what's strong rather than focusing on what's wrong, which is positive psychology in a nutshell.
Absolutely. And positive psychology is the kind of one of the underpinnings for lifestyle medicine. But I love that word, empowerment, right? that is the bottom line goal for all of this. It's empowering ourselves and empowering our patients and giving people the tools to feel like they own their care. We should never be doing anything else, right? Right.
Right. Thank you. So yes, I will share the resources to the American College of Lifestyle Medicine and any resources you have for our listeners as well. Thank you so much for your time.
No, absolutely. Humbled to be here. So thank you so much.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.